Estradiol, drug information. Generic name. Estradiol. Drug class. Estrogen hormone, female sex hormone. Description. Estradiol is the most potent natural estrogen produced mainly by the ovaries in women. It plays a vital role in the development and maintenance of the female reproductive system and secondary sexual characteristics. Medically, estradiol is used to treat conditions caused by low estrogen levels. Mechanism of action. Estradiol binds to estrogen receptors, ER-alpha and ER-beta, in target tissues such as the uterus, breast, bone, and brain. This activates gene transcription responsible for growth and maintenance of female reproductive organs, regulation of the menstrual cycle, preservation of bone density, maintenance of vaginal and uterine tissue. Indications/uses. Estradiol is commonly used for menopausal hormone replacement therapy, HRT, relief of menopausal symptoms, hot flashes, night sweats, treatment of estrogen deficiency, prevention of postmenopausal osteoporosis, hypogonadism in females, gender-affirming hormone therapy, certain cases of breast or prostate cancer, specialist use. Dosage forms. Estradiol is available in multiple formulations. Oral tablets, transdermal patches, topical gels and creams, vaginal tablets, rings, or creams, injectable solutions. Dose depends on indication, age, and patient condition. Pharmacokinetics. Absorption, well absorbed orally and transdermally. Metabolism, primarily in the liver. Half-life, approximately 13 to 20 hours, varies by formulation. Excretion, urine and bile. Side effects. Common side effects include nausea and vomiting, breast tenderness, headache, weight gain, fluid retention, mood changes. Serious side effects, rare but important. Thromboembolism, stroke, myocardial infarction, breast or endometrial cancer, long-term use. Contraindications. Estradiol should not be used in patients with known or suspected breast cancer, estrogen-dependent tumors, history of thromboembolic disorders, undiagnosed vaginal bleeding, severe liver disease, pregnancy, drug interactions. Enzyme inducers, e.g., rifampicin, phenytoin, may reduce effect. Estrogen effects may increase with CYP inhibitors. Reduced efficacy when used with certain antibiotics. Precautions. Use the lowest effective dose. Regular monitoring in long-term therapy. Caution in patients with hypertension, diabetes, or migraine. Combine with progestin in women with intact uterus to reduce cancer risk. Storage. Store at room temperature, protected from light and moisture.